Alright, random and interesting pharmacy things, part 5. Steroid ointments are more potent than creams. Here's a little topical steroid potency table. One example is triamcinolone ointment, 0.1% up here. Then we have the cream down here. Another random interesting pharmacy thing is enzyme-inducing drugs, or drugs that induce or increase the metabolism of other drugs, take a while to work, as an inducing agent. This has to do with how long it takes transcription and translation and the upregulation of metabolizing or CYP enzyme. Other enzymes that can be affected are PJP efflux pumps and UGT, so it can take a couple weeks for a drug to induce the metabolism of other drugs. It's not immediate. De-induction also takes a little bit of time once the drug is actually out of the body, meaning like days after your last dose, you can still have induction or increase in metabolism of other drugs. It takes time for the inducing enzymes to return to normal after the last dose of the inducing agent. It may take days and possibly weeks depending on the elimination of the inducing agent, as well as natural degradation of the enzymes. Why is this important? Let's say a patient's on carbamazepine or rifampin and they're also on an oral contraceptive. How long do they need backup contraceptive after they stop that carbamazepine or rifampin? Again, these drugs are enzyme inducers. They're inducing the metabolism of the contraceptive agent. So you're going to have less of that birth control in your body, so a risk for contraceptive failure and pregnancy. I would say backup contraception is necessary for 4 weeks after cessation of carbamazepine just to be safe, and up to 6 weeks possibly with rifampin. Another interesting pharmacy concept is enzyme inhibition. So enzyme inhibitors decrease the metabolism of drugs and increase concentrations and risk for toxicity. Inhibition of enzymes occurs once the drug's in the body. It also stops inhibiting once the drug is out of the body. General rule of thumb, 3 to 5 half-lives for a drug to be cleared from the body. So let's use Paxlovid for an example, the COVID drug. The ritonavir in the Paxlovid is a strong CYP3A4 inhibitor. Paxlovid has an elimination half-life of about 6 hours. So let's say someone's on Lipitor, atorvastatins for cholesterol. Statins are the main drugs we use for cholesterol. I use the acronym ASL for the 3A4 mediated statins, so atorvastatin, simvastatin, lovastatin. Paxlovid is a 5-day course. What I recommend for my patients is to hold the statin for 7 days. So again, half-life of about 6 hours, multiply that by 5 on the upper end, it's about 30 hours. Paxlovid interactions can become complicated like I've mentioned before, so if like patients are on like blood thinners like Eliquis, do we dose adjust or do we hold it? This should be shared decision making between the provider and the pharmacist. Paxlovid is more effective than the other COVID drug in the market, molnupiravir or Lagevrio, but it also has a lot of drug interactions. Always consult your pharmacist when navigating drug interactions.